Welcome back to Rare Connection, the podcast where rare voices are heard, shared, and supported. I'm your host Joanna, and before we begin, I want to remind our listeners the information in this episode is for informational purposes only, and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult a qualified healthcare provider with regard to your medical condition. Never disregard medical advice or delay seeking it, because something you hear on this podcast today. Today's episodes features a powerful story for someone living with an unnamed and likely ultra rare medical condition. Our guest is Brenda, a woman living with a painful and disabling disorder that her doctors are calling an orphan disease. She has she is HLA-B27 positive, a genetic marker often linked to inflammatory or autoimmune conditions, but her specific presentation doesn't match any known diagnosis. Brenda has endured repeated tendon inflammation and spontaneous tears, a pattern that defies classification under existing conditions like VEXAS, relapsing, polychondritis, magic syndrome, and all of which she is tested negative for. Brenda is here today to share her diagnosis journey, her resilience, and how she continues to push for answers when the medical system doesn't have a name for what she's facing. Brenda, thank you so much for being here.
Thank you for having me.
Let's start with your story. When did you first notice something wasn't quite right with your body?
In my early 30s, started with ankle pain. Thought I, sprained my ankle, twisted it, went to the doctor. They said, you twisted your ankle, you'll be fine. Months went by, then the other ankle started hurting, and went to an orthopedic. They did an ultrasound and a MRI, and found that in both ankles, tendons were torn. And I had surgery on both ankles 6 months apart. And then same symptoms in my wrists. So they told me to quit the gym because it was hurting me. And I started riding my bike and tore a meniscus in my knees, and surgery on both knees, and it just kept continuing. And after 14 surgeries, the orthopedic said, okay, something's wrong with you, and sent me to a rheumatologist. And they discovered the gene and prescribed a medication that my husband was not at all comfortable with because of the side effects, and said, we need a second opinion. And so we sought out another doctor, and he agreed with the diagnosis of an HLA-B27 positive autoimmune disease, and agreed with the treatment. And we weren't comfortable with that. And because we live in a small town, so I thought that, this was bigger than what small town doctors have ever seen, and sought out more specialists. And they They tested me for every possible disease known to them. And 20 years later, I still don't have a name for my disease.
Yeah, they are still discovering certain conditions under this.
Yes.
It's um, what are your earliest symptoms, and how long did it take before someone considered this might be more than just a common injury or condition?
6 years from the first symptom of my ankles. It took 6 years for to see a rheumatologist, and um, they. So I had a. I went to a specialist in New York, and um, he said it's an inflammatory process. Your immune system, the HLA-B27 gene, tells my immune system that my soft tissue is foreign, so it attacks my soft tissue. And with me, it's settled in my tendons. So all of my tendons are inflamed, and they become so inflamed that they tear. They started me on Plaquenil at the beginning, and um, then I went to methotrexate, and then to biologics. And I continue to tear tendons. They don't understand why. They just go, it's the immune system is attacking your body, and we can't stop it. It's the gene, and we can't, we can't stop the process. We can minimize your symptoms, but we can't stop it.
Right. As long as they don't have a name for it, it's a little bit hard to go anywhere.
Yeah,
So,
and insurance wise also, because it's
yeah,
not an FDA recognized disease.
yeah.
So there was a lot of insurance issues. So it's been a very frustrating journey. Um, and to think that, the doctors say, I have never seen anybody like you.
Mhm.
For me is the hardest part, because I'm going, I cannot be the only person that has this. They've tried many different names to fit me in categories of diseases, and
Mhm.
I don't fit any of them. So I confuse every doctor I see.
Mhm. And that's typical for rare disease patients. So but
It's very difficult for my doctors as well.
yeah. So yeah, I would imagine it would be, but and especially when doctors tend to like to talk to um, test for common conditions, and common and rare do not mix.
no, yeah, yeah. There was no way for me to expect them after we found out what was wrong, when I got dismissed at the very beginning. In fact, the first orthopedic I saw told me that I was a stressed out, overweight, stay at home mom, and all I needed to do was lose weight and exercise, and I'd be all better.
Yeah. Uh,
And I'm going,
nope.
okay. I didn't go back to him.
Yeah.
Um, and so when I found because I saw several doctors over the past 20 years, um, if they don't know what's wrong with you, then it's your fault.
Mhm.
Well, you're doing something. It was always, what are you doing? You're injuring yourself. You know, you're doing something to cause your tendons to tear. So that's like when they said, stop going to the gym because weight bearing exercises are hurting you. That's why I started riding the bike. Well, riding the bike's hurting you. Um, so I started swimming. Well, swimming's hurting you. And got to the point, well, no, these things aren't hurting me. something's going on. I mean, I would wake up in pain and have a torn tendon.
Mhm.
I closed my dresser drawer one day and tore a tendon in my elbow. So it's any movement for any reason or for no reason, and I end up with a torn tendon. And when I go to the doctor and they say, what did you do? It's like, I woke up.
Mhm.
And
Have you had any
so,
bone density tests?
yes, yes,
Yeah,
it's not my bones. My bones, so it's all the soft
they're
tissue.
connected. They're
Uh,
connected though. So it's
yeah, I mean, I get uveitis.
Mhm.
Um, I get skin irritation, but it's more like severe inflammation, redness. And that took a while for them to go, maybe that's part of your disease, where it looks like cellulitis,
Mhm.
but it's not. It's my disease attacking my skin. Um, and so as time's gone on, there's been different symptoms that show up and they go, oh, well, it's probably your disease. We know nothing about your disease, but we don't know what this is. So everything now that comes up, they go, oh, it's your disease. But we know nothing about it, but we're just going to assume, because you're so odd that, um, so yeah, I'm definitely a mystery to my doctors. It's physically um, very painful. My wardrobe consists of some orthopedic brace on some joint, sometimes multiple braces on multiple joints. Um, but that's just part of my wardrobe. I mean, people, when they see me, when friends see me without a brace on something, they're shocked. Like, oh my God, I've never seen you look normal. And I'm like, whoa. um, so um, I've become so used to the pain that I don't really know what it's like to not have pain.
Mhm.
Um, I I'm in pain every day. Something always hurts. Uh, at the moment, I'm dealing with well, a bunch of stuff with my knee, which is torn meniscus, torn cartilage, torn quad tendon. Um, the surgery is not an option for me anymore because it's an inflammatory process. I
Mhm.
had prior to the diagnosis had 14 surgeries to repair tendons, but then that would create more inflammation in my body, which would cause more tears. So I was stuck in this vicious cycle of surgeries, and finally got smart enough to go, No more surgeries. I can't do this anymore." And now I'm doing PRP and stem cell, which has
Mhm.
helped a lot. Um, Not approved by the FDA. It's private pay. It's very expensive. Um, but I'm walking. Without that, I would not be walking.
Mhm.
So that's been
Have
an
you
amazing treatment for me.
have you tried an anti-inflammatory diet?
Oh yes, I've done every trick in the book,
Yeah. So
and actually the diet's healthy, but it doesn't really affect my inflammation. I mean, probably, but when I get my labs done, and if you're familiar with inflammatory markers, they're always high. They thought that the Plaquenil and the methotrexate and the biologics would bring down the markers, and they do for a little while, um, but not enough to stop the inflammatory process that causes tears. So it's just, I live in my orthopedics office. I live in physical therapy. Um, And, I just came to accept that's my life. I mean, it's been like this for 22 years now.
Mhm.
Um, and the only thing that these medications have done and really that hasn't changed much, is I just stopped having surgeries and now doing PRP and stem cell. So I continue to have multiple torn tendons. Um, and some don't always require treatment. Some will subside on their own, and others will go into flow bone tears. And um, so there's no way to judge what my body's going to do at any given moment. I can wake up today and feel fine and get to work, and you know, my wrist will be inflamed or my ankle will be inflamed, um, and I just roll my eyes and go, how long can I wait before I have to call my orthopedic and have some treatment?
Yeah. So they pretty much have to treat the symptoms at this point.
Exactly, because
Yeah.
they can't. They Yeah, exactly. They just treat the symptoms, and I've had doctors that have been so frustrated they just go, I can't help you anymore, which means they're pretty much tired of me coming in constantly with another torn tendon. I've had a lot of doctors that just throw up their arms in defeat and go, I don't know what to do anymore. So you got to find the right medical team.
Mhm.
And then that's the most important thing, is finding somebody that's willing to or to be there long term, to have the patience to deal with it. Because it is frustrating for them, because especially with orthopedic, they want to fix things. They don't want you to come back with the same problem. It's like, I fixed you, don't come back. um, but I have a great team now. I've had a great team for the last 10 years. um, I get an injection of methotrexate once a week, an infusion of biologic drug every 8 weeks, and a handful of medication. And I just go about my normal life as best I can.
Mhm.
It does limit me with a lot of, physically, especially my knee. It really hampers, walking long distance is impossible. Um, but, I make adjustments and do the best I can.
Yeah. So you use a walker at all?
No,
Mhm.
no, that
But you have
wouldn't
an
really
access
help. I
point.
mean, hmm?
Well, you have a place to sit down at least if you, yeah, with some of them.
Yes, you just go, well, it's kind of like, how far away is that? Like when we're going somewhere, oh, it's just like 3 blocks away. And I go, oh, Lord. Um, so it's stuff like that where, um, yeah, it's limiting.
Mhm. Um, how did you learn about, how did you learn you were HLA-B27 positive? How did that
A
affect your
blood
diagnosis
test.
journey?
It was a blood test,
Mhm.
because they were testing me to, they go, oh, and as soon as that came up, they, went, okay, well, there's part of the answer, because this is what, this gene can do. I mean, it can also, do other things, but for me, and so that's where it's like, okay, you're HLB-B27 positive. Um, because it's a rare gene, it's not like, an infection that you can take medication, antibiotics for and get rid of. It's like, it's here forever. Um, Oddly enough, my twin sister also has the gene,
Mhm.
but has no disease process.
Yeah.
So, they go, I wonder what triggered it in you and not in her. Another mystery, you know.
That happens a lot. Yeah, just because one family member has something doesn't mean another one's going to have it.
Well, when they found the gene, they said you need to get your siblings to get tested for the gene.
Mhm.
And I have there was 5 of us, and my twin sister was the only one that wanted to get tested. And she came up positive, and the doctor said, well, we would assume that she would be positive because you're twins. Not doesn't necessarily have to happen, but they were not surprised when she was positive. But she has no symptoms at all. So the
But
theory is they think that I may have had some type of infection. It could have been a normal infection, like a sinus infection or a intestinal infection that triggered the gene. So, I mean, that's their theory. They don't know. There's so many things they don't know.
yeah. Uh, since it's genetic, is there any kind of do you know what chromosome it's attached to?
I don't.
Yeah.
I don't think, no, I don't have a clue.
Yeah.
I mean, I went through a bunch of, a bunch of testing, and still with no answers. So,
Yeah. How did that affect your diagnostic journey?
people ask, like when you talk with other rare disease patients, and the journey to a diagnosis was the goal. I just need a name for my disease. It would be, and so people go, well, how did you feel when you got diagnosed? And I said, I'm not diagnosed. I mean, they I don't have a name for it. Um, they keep coming up with different names for it, but I don't have a name. So, it's you come to a point where you go, well, it doesn't really matter anymore what the name is. The treatment is what's the most important for me, is how can we make my life less painful? And that's also still a mystery. It's like, I mean, the stem cell and the PRP, the problem with those is they're only temporary. They only last, some only last, 3 months, others can last a year and a half. It just all depends. So, um,
So what does PRP stand for?
platelet rich plasma.
Mhm.
They draw your blood and they spin out the platelets and then inject them back into the torn tendon.
Mhm.
And so the theory is that the platelets have healing properties that can help heal the tear.
Mhm.
And stem cell is they drill a hole in my hip and draw out the bone marrow and spin out the stem cells and then inject them back into the injured area. That's way more invasive, way more
Yeah, it can be
painful.
very painful. Yeah.
Yeah. But they help a lot. People always go, well, are you going to get a knee replacement? And I'm like, no, because that's not the issue.
Mhm.
And so, like, when I come walking out of the doctor's office limping in a brace, they go, oh, did you have a knee replacement? And I'm like, no. Then I go, ooh, don't say it like that. Um,
Yeah.
but that's not my issue. It's not my bones.
Mhm.
So that this is at this, but prior to having PRP and stem cell available, it was steroid injections, but you can't do steroid injections in tendons. Um, and so it was really just, popping Tylenol and ice and elevate. And when stem cell came around, what, about 10 years ago, um, maybe not quite that long. I mean, the first time my doctor told me about it, and I came home all excited and told my husband, and he's like, "Are you out of your mind?" And I went, "What?" No, I have no other options because this was so brand new.
Mhm.
Um, my my primary care doctor thought I was crazy. My rheumatologist absolutely did not want me to do it, and I looked at all of them and said, "I'm doing it." I have no other options, no other choices, and I'm doing it, and now they're so glad that I do.
Mhm.
And so am I. And so now
Yeah.
it's becoming more mainstream now, than it was when I first started. When I first started, it was in an OR, and now it's in an exam room. I mean, so I've watched it change, um, from the very beginning to now it's an in-office procedure and no big deal.
Mhm.
Um,
Can you tell us what, see, you said you were tested for other conditions also. What did those tests involve, and how did doctors rule them out?
they were all blood tests to test for, um, all other autoimmune diseases that, so all of my testing was just blood work. We did do biopsies, and the biopsies were inconclusive. They would just show inflammatory cells. Um, so they go, well, you have inflammation. But they did a whole panel of blood work for diseases I don't even know what they were looking for. And well, you don't have this, you don't have that. And so it just still doesn't have a name,
Yeah.
except for an orphan of a rare HLA-B27 positive inflammatory connective tissue disease,
Hmm. Long
which
name.
pretty much is the best way to describe it in layman's terms. The actual, yeah, that's pretty much what he calls it.
So, what has it been like to hear that we don't know what this is for medical professionals?
What is it like for them?
For you.
Frustrating. It's the best, it's like, um, because you think, you're supposed to know what's wrong with me. Um, so I'm so used to them. It's like every doctor, it's like, I've never seen anybody like you. And I just like roll my eyes and go, yeah, I know. Or you're the first person I've ever, and I go, yeah, I know. um, I mean, so I
Uh,
guess the biggest thing in my life is just sheer frustration that we can't control this.
mhm. So you've had tendon tearing, which is unusual even for inflammatory conditions. Has anyone explained what might be happening on a tissue level?
Uh, no, just that the tendons themselves become so inflamed that they eventually rupture. Um, so yeah, my orthopedic said I could put an ultrasound on any tendon in your body and it's abnormal. So the structure of my tendons are abnormal because of the disease. Um, though when I was first diagnosed, and my mom she said, well, when you were a kid, you were always spraining your ankle or your wrist, or you had swollen joints. So I had signs back in childhood, but you could always contribute them to some sort of activity, which also happened, throughout my life, but one time I slipped off a flip flop. My feet were wet and my foot went sideways and I twisted my ankle. And so my husband, this was before I was diagnosed, my husband would make fun of me. you can sprain your ankle falling off flip-flops. It's like, I mean, that's how easily things can tear.
Yeah, you
Just
just
sit,
reminded me of something. It's just, I have a friend who told me I could slip on air, I could trip over air.
yep,
So
and hurt yourself. It's like, um, and for, so yeah, so doctors treat me like I'm fragile. It's like I'm fine china that if I, move wrong, I'm going to break, which is very irritating to me because I don't view myself that way. I still think I'm perfectly normal, capable of doing anything I want to do. Um, and I kind of have the attitude of I'm going to do whatever I want to do because it doesn't matter what I do. So I might as well have fun.
yeah,
I mean, not that I would purposely go hurt myself, but it's like, yes, I'm going to go do, whatever it is I want to do. Um, and they go, well, what if you get hurt? And I go, I can get hurt in my sleep. So I can't live my life afraid that if I move wrong, I'm going to tear something.
yeah,
So I kind of got really defiant with my disease and went, I'm going to do whatever I want to do within reason.
yeah. So what kinds of specialists are involved in your care, and how do they support you despite the diagnostic uncertainty?
Um, my main one is my orthopedic and a rheumatologist. Um, are my two main doctors. It's just not playing with, but it's just adjusting the medication, um, dealing with the side effects versus the benefit of the medication. Like methotrexate is horrible. Um, and, uh, it's the quality of life. Because I'm generally a very happy, positive person.
Mhm.
And so I don't go in the doctor's office, whining and complaining. I'm like, just please make this feel better so I can get on with my life. Um, my orthopedic is wonderful. He's not a surgeon, which is the best part. It's like he's uh, so they do the PRP and the stem cells. So he's actually my one I see the most often. I see my rheumatologist every 3 months. And the rheumatologist is, he's in New Orleans, so he's 4 hours away from me. So we travel to my doctor every 4 months. We had the choice between a doctor in Birmingham, Alabama, or New Orleans.
Mhm.
Same qualifications. And my husband looked at me and he said, where do we want to go every 3 months? Birmingham or New Orleans? And we're like, New Orleans. So we have my appointments on a Friday. We spend the weekend in New Orleans and have fun. So
Yeah. Well, that's the other thing. A lot of rare disease patients travel to other states or really far away. How far do you travel?
it's 4 hours
Oh,
drive time.
yeah.
Um, but it's not bad. I mean, I know of other people that have to fly across country,
Yeah.
which makes it like when I saw the doctor in New York, he said, I would be happy to have you as a patient, but you would have to be able to travel from Florida to New York every 3 months. And if you can do that, great. But I understand that would be difficult. And so he recommended the doctor in New Orleans, which was much easier to get to. Um, so, because, I live in a small town in Florida. We don't have um, the specialists that I need. So there was no other option but to travel. So, which isn't that bad because I get to go to a fun city. So, you know,
Mhm.
I find ways of making a very stressful situation, you throw in a little bit of fun. I mean,
Yeah. So what do you do while you're in New Orleans?
Oh, it's all about the food.
Yeah.
It's definitely all about the food. We sit there and go, okay, where do we want to eat, this trip? I mean, but we've gone to New Orleans. I've been with the doctor for 20 years, and we were just because I'm going next month, and we're like, well, what do we want to do in New Orleans? And it's like we've done everything. It's like, okay, what restaurants? So we'll find new restaurants, and um, New Orleans is it's the French Quarter's fun, but we've been there, done that many times. Um, but it's just to get away, um, go eat a nice dinner, go eat a nice lunch, drive home, go shopping. There's an outlet store on the way there that always hit up the stores and go shopping and go out to eat. And
Mhm.
so, I'm as normal as everybody else in my life. I mean, by looking at me without my braces, um, I look completely normal.
Mhm.
Um, so it's not that somebody would look at me and go, oh, I wonder what's wrong with her. But when I have braces on, like there was one time I had um, a wrist brace, a knee brace, an ankle brace, and both my elbows were taped with we call it medical grade duct tape. And we were in a store, and a kid like 10 years old was looking at me, and I'm going, well, I would look at me too. It's like,
Yeah.
and they're going, I wonder what happened to her. And the mom's going, don't stare, so, and I'm going, hey, it's okay. I would stare at me too,
Yeah. Almost like your suit of armor.
exactly.
Yeah.
It's like, yeah. Or, you go, yep, uh, this is just part of my wardrobe. And the little things with the disease that people don't understand is all the little things like, what am I going to wear with this knee brace, or what, you know, because you have to wear the knee brace against your skin.
Mhm.
And so it's like, well, there's been times when I've, been so frustrated because, and throwing clothes on my bed and crying because I don't have anything to wear. It's like, um, so it's the little things like that that are even more frustrating than the bigger issue of what my body's doing to me. It's the everyday stuff that, it's frustrating when you can't get dressed because of the braces. I was in these arm sleeves. I had these because my elbows are torn. And to try to get rid of some of the inflammation, there were these compression arm sleeves. And
Mhm.
we were going to a show, and I'm trying to figure out what to wear. And it was the summertime. So, and I had all these cute dresses with little cap sleeves, and I put them on, and I'd stand in the mirror and look and go, this looks stupid. So it's stuff like that that I catch myself that I would get the most upset about because
Mhm.
it was something I could visualize and see and get irritated with because I couldn't fix it. And my husband would go, well, you know, you could just not wear them for one night. I'm like, well, very true. Instead of, crying over what I'm going to wear. So, um, but yeah, that can be very frustrating when you can't find clothes to wear that will work with a brace.
Yeah. So you're navigating life with a disease that doesn't yet have a name. How do you find direction when there's no established roadmap?
I don't have a direction. That's a good question. I stopped thinking that it was important to get the diagnosis. What was important is how I was going to live with what I have. Um, because you ask the question so many times, what's wrong with me? What's wrong with me? And I don't know. Um, I got tired of hearing I don't know.
Yeah.
So I stopped asking.
Mhm.
You know, it's like we kind of know in general what's wrong, but we don't know what to call it. And really they don't know how to treat it. I mean, they throw these medicines at me and it's all experimental because it's never been used on anybody else before, or so they say. And so they every time they do something, they go, well, we don't know if this is going to work. You know, it's kind of like you tell us.
Yeah.
And I'm going,
Yeah.
okay, you know, it's like, well, I don't like this medicine. It makes me sick. You know, it's like, well, you know, that's just part of the medication. I'm like, well, I can live in pain, but I cannot live sick.
Mhm.
I can't live in my bathroom throwing up in diarrhea. I can live with pain, pop some Tylenol, and go on with my life. So don't make me sick, especially if it's
Yeah.
not working. You know, I'm not going to continue a medication that the only thing it's doing is making me sick. Um, so, yeah, I kind of, you know, take control in that way that if it's not helping me and the side effects are worse than the benefit of the medication, then I'm not taking the medication.
Mhm.
Uh, you know, there was a big thing about, you know, I wanted to stop methotrexate. Um, and so, you know, he was very resistant. My doctor was very resistant about stopping it. And I said, hey, look, I'm sick of being sick. I cannot function being sick. You know, and so I went off of it for a while and none of my markers changed. I mean, we thought the markers would go through the roof, and then we're going, well, then what was methotrexate doing for me if I'm still tearing tendons and my inflammatory markers, you know, haven't changed, then and all I am now is just sick. So I stopped taking it.
Mhm.
And so now I'm just on the biologic and Plaquenil, and everything's still the same. It's just, yeah, but I'm not sick.
Yeah.
So that's a benefit for me. And
Mhm.
my husband said, you know, after I stopped methotrexate, he goes, I have my wife back. And I went, what?
Yeah.
Because I would be in bed for 2 days, you know, vomiting, diarrhea, just, you know, felt horrible. And then the next 2 days were recovering from feeling like that. And so I'd have, you know, 1 or 2 days a week where I felt somewhat normal, and then the whole process would start over again. And um, so I feel so much better off of it.
Mhm.
And it hasn't changed anything with my disease. Um, so I don't know what the next step is. Like I said, I see him next month and we'll discuss if there's any other treatments out there.
Mhm. Have you been connected with any rare disease networks, network researchers, or
No,
genetic studies, trying
no, I
to,
haven't. I don't know of any.
yeah.
You know,
Okay.
like when you try to research my disease, there's nothing there. You know, I joined a support group, you know, with Global Gene and relapsing polychondritis because of the disease also attacks the cartilage in my ears. And so my
Mhm.
ears become really inflamed and painful. And that's a characteristic of relapsing polychondritis. Um, and that's the only group that when I say my ear hurts, they know exactly what I'm talking about.
Mhm.
But I don't have any of the other characteristics of that disease. So there's a lot of things that I can't relate to of what they go through. But they're the only group that I've found that's close, that I can relate a little bit to. So that's the only outlet that I have, the only group that I'm associated with that understands a little bit of what I go through.
Mhm. I can give you the name of a couple researchers. I don't know whether they
Okay,
do anything with this, but I have done podcasts with two different researchers.
okay.
Um,
Yeah, email that to me.
yeah, we'll do. What message would you share with others who are living with an unnamed uh, misdiagnosed condition, especially when women whose pain or symptoms might uh, be dismissed?
Be persistent. Uh, keep pushing to get answers or to get treatments and get relief. If you're not happy with your doctor, find another one. Because the most important thing is to have a good relationship with your doctor.
Mhm.
Um, that's one of the most important things, is have somebody that is willing to keep moving forward with you and finding ways to make you feel better. I mean, I'm never going to have an answer, or I'm never going to have a cure. Um, but I can form lasting relationships with my providers to help me to be as comfortable as I possibly can be. So you just have to, you really have to be positive. If you get to the point where it's depressing and negative, and
Yeah,
what your what you tell your mindset really affects your body. If you're angry and bitter, and your body's going to feel it. You have to be positive. You have to find a way to overcome, I guess. Um, you have to find a way to adjust, constantly adjustment to your conditions. Um, you have to accept it. That's the biggest thing. You have to accept it. Um, I mean, I could be angry and bitter and miserable, but that would be horrible. I mean, that would be worse than my disease, to lay around my house and feel sorry for myself. You just got to make the best of what you have. Yeah, it sucks, but if I walked around and said it sucks all the time, then it would be worse than what it is.
mhm.
So I shrug my shoulders and go, yeah, my knee hurts, or, this hurts, and I don't like it drives my husband crazy, because he'll say, how do you feel? And I go, okay. Why is it you always just say, okay? And I go, well, what do you want me to say? This hurts, that hurts. I mean, that would annoy me. I don't want to hear it. I don't want to say it. If something's horrible, I'll tell you. Otherwise, I'm good. Let's go have fun.
Mhm. So, Brenda, thank you for sharing your story
Well,
with
thank
us
you for
today.
having me.
Sure. Your strength, honesty, and persistence are powerful. Reminder that even when a disease doesn't have a name, the person experiencing it still deserves answers, care, and community.
Yes, they
To
do.
our listeners and viewers, if this conversation resonates with you, please take a moment to subscribe to Rare Connection wherever you get your podcasts, and don't forget to subscribe to my YouTube channel, Rare Chef, where where this interview is also available, as well as cooking videos. Um, I'd love to hear from you. Um, If you're watching um, on YouTube, just comment below. If you are listening to the audio version on one of the audio stations, or it is also on YouTube, you can also, there's a send me a text link in the show notes. I personally read every response. I personally read and respond to messages from listeners. You can follow Rare Connection on Facebook, LinkedIn, X, and X formerly Twitter for episode updates, guest highlights, and rare disease advocacy news. And remember, if you or someone you know or you care about is struggling with your mental health, help is available. You are not alone. Please check the show notes for resources, including phone numbers and text numbers, where you can reach trained professionals 24/7. So those are basically 988 is one of the numbers you can either call or text. And you can also text hello to 741-741. Until next time, stay connected, stay hopeful, and always stay rare. Thanks. Following quiz is an open book quiz, and I'm trying to get more viewership with it. You will have to go back and look at the answers if you don't know them. These are mostly podcast specific, and so you might be able to find one or two of them elsewhere, but not very many. This is all on the podcast I'm doing now. So HLA-B27 is a genetic marker. What does it affect? How long did it take Brenda to get diagnosed? True or false? If one family member had a genetic condition, other family members will also have the same condition. What does Brenda wear as part of her wardrobe to help her with her medical condition? How was Brenda diagnosed? How far does Brenda travel for care? What does Brenda do for fun while traveling to her medical appointments? What specialists are involved in Brenda's care? What small issue does Brenda have in her daily life? How does Brenda decide when she won't take a medication? So those are the answers. Those are the questions. I will post answers later on, and when I'm getting closer to the other podcast. Mostly the post on social media. It's harder to do on YouTube, but I can try and compile them together also. But my Facebook is Joanna Ball, or I also have a Facebook under Joanna Lee. Following quiz is an open book quiz, and I'm trying to get more viewership with it. You will have to go back and look at the answers if you don't know them. These are mostly podcast specific, and so you might be able to find one or two of them elsewhere, but not very many. This is all on the podcast I'm doing now. So HLA-B27 is a genetic marker. What does it affect? How long did it take Brenda to get diagnosed? True or false? If one family member had a genetic condition, other family members will also have the same condition. What does Brenda wear as part of her wardrobe to help her with her medical condition? How was Brenda diagnosed? How far does Brenda travel for care? What does Brenda do for fun while traveling to her medical appointments? What specialists are involved in Brenda's care? What small issue does Brenda have in her daily life? How does Brenda decide when she won't take a medication? So those are the answers. Those are the questions. I will post answers later on, and when I'm getting closer to the other podcast. Most of these I post on social media. It's harder to do on YouTube, but I can try and compile them together also, which I haven't on the Joanna Ball account yet. But anyway, so before I go, I want to show one more thing. So this shirt is a shirt I made on Bonfire. That sells for $24.95. The image does have symbolization, and which does explain on the back, and I can't show it right now because I'm wearing it. But the zebra is a symbol for rare conditions, and the sunflower is a symbol for invisible disabilities. Many rare diseases are both, and so that is something if you are interested in the shirt, it sells for $24.95. I paid $5 for shipping on it, and it does come in a variety of colors. This one is short sleeve only. I do have two others that come in both long sleeve and short sleeve, and those are which I do have both short sleeve and long sleeve. Those are I have one for the podcast Rare Connection, and I also have one for my YouTube channel, Rare Chef. Besides the podcast, which is something I'm more involved in right now, I also do cooking videos. Generally, when I don't have a podcast, or it's basically filler. A lot of times. But I will be doing more cooking videos in the coming days. And I thank you for your time.